to the Global View podcast. I'm your host, Josie Kim, and today we'll explore plastic pollution with an exclusive interview with Madison Dennis, a leader from the Plastic Pollution Coalition. Plastic pollution is one of the foremost issues in our community today. From microplastics in our food to larger chunks in our waterways, the plastic crisis is global, and the issue is still growing today. Dennis will reveal what the Plastic Pollution Coalition is doing to help mitigate this issue and why it's so important to address. Without further ado, let's get started. So the first question I have for you is, can you please introduce yourself and feel free to include information about your background and role in the Plastic Pollution Coalition?
My name is Madison Dennis, she, her pronouns, and I'm a project manager with Plastic Pollution Coalition, managing our Filtered Not Bottled campaign, which I know is what we're hoping to talk about today, but also our Global Plastic Laws project, which is an extensive database tracking all past plastic legislation all around the world. I came to this work really through marine biology, which I think is a very common story in the plastic space. I have studied marine biology and conservation in school, and I really turned to advocacy because as I was, actually performing the science, I was realizing that there was a really big disconnect in what we know and the systems in place and the general public awareness. So I wanted to really help communicate that science outward. That really led me to organizing. So I've worked on a bunch of different issues from clean energy, tech equity, clean air, but really came to plastic from the familiarity with the impacts on our oceans and on our beaches. But through that work, I just started to see the true upstream impacts and the health outcomes. So one, the impact of production and disposal on frontline communities, but also the health outcomes that all of us are facing from continually ingesting plastic, either intentionally or unintentionally, and the health outcomes that we're just starting to understand.
What inspired the launch of the Filtered Not Bottled campaign?
So back in 2021, the bipartisan infrastructure law was passed by the Biden administration. And in this law, there was $15 billion for lead pipe replacement. So lead pipes are actually outlawed in the 80s, but there are still many, many pipes still across the country. There's 9.2 million households that we believe are serviced by lead pipes. And we know this disproportionately impacts Black, Brown, Indigenous, rural, and low-income communities. So it wasn't a super obvious issue for Plastic Pollution Coalition because our expertise is plastic, not lead. But we knew that, one, this was going to take years, the actual replacement of all the lead pipes. This is not all the funding needed to complete lead service line replacement across the country. And there's going to be decades, 10 years at best, decades likely, before clean water can be ensured. So we were thinking, how will people be getting their water in the meantime? And plastic water bottles has commonly been the response. We then really started this campaign to mitigate the billions and billions of water bottles that were likely to be distributed and used to ensure that there was no lead in the water. And we also advocate for a solution of filtration. There are filters that are certified to remove lead, and they're much cheaper, but they're also safer and more sustainable. And it's a great way to ensure, one, that you're not exposing communities to lead, but you're also not exposing them to additional health and environmental harms of plastic pollution.
Perfect. What are some ways policymakers or communities can work through legislation or other avenues in order to ensure that all households affected by lead pipes receive water filters and replacement cartridges?
So we advocate on a multitude of different levels throughout the legislative structure. So we primarily started with the EPA. There's under the Safe Drinking Water Act, there is the lead and copper rule, which really dictates how water systems across the country deal with lead pipes, when they need to be replaced, and how they do that. So we have been advocating for expanded filter requirements in that lead and copper rule, distributing it direct to households. We saw a big improvement in the recent lead and copper rule improvements, but we know that there's still a lot of work to be done federally to ensure that all of that all of those filter programs are completed across every community in the country because when a lot of the impacted communities are underfunded and underserved, so we need to make sure that the federal level is really dictating sound policy. But we're also now working on filter laws at the federal and state level that are requiring the free distribution of filters to households impacted with relevant community education. And then also looking at a variety of more communications and health focused avenues, such as partnering with the Department of Health in impacted states and also the governors to expand guidance on filtration and some of the health harms of bottled water.
What are some obstacles you faced in implementing this initiative?
So we say often that this campaign is really pushing on an open door, as in many people agree and I think they see the benefit of using filters over bottles. But I think a lot of it is also just as I mentioned, a lot of the water systems that are impacted are underfunded and underserved. So we need to make sure that there's better education, better guidance from the federal level, because people really shouldn't have to pick their poisons, picking lead or plastic. And I'll also just say that filters have been employed across the country, but we're seeing that the way they're distributed and the education around it can really impact how successful the program is. So that's one of the obstacles we're facing is just trying to provide better resources to water systems and regulators on how to effectively do this. And we know it's one direct distribution. So sending filters directly to the home, really reducing the financial and time burden for accessing it. And then also having one language relevance, so making sure you have education materials in all of the spoken languages in the community and better community engagement to build trust in education.
Can you elaborate on what a filter first approach in schools and children care centers entails and why it's such a crucial step in ensuring children have access to safe drinking water?
Yeah, so I can say our campaign focuses primarily on filters in the home. We know that's critical to ensure safe water use for drinking, cooking, and washing, but children are exposed throughout the full school day as well. And we know that most schools in the country have at least some level of lead. The Filter First campaign really comes in because testing has been insufficient in schools for lead levels. And even as that's been increased and more schools have tested well above the safe level of lead, we find that the testing results are highly variable. Because of that, and the particularly damaging impact of lead on children, it can have irreversible health impacts from impaired growth and development. We know that we can't wait for a negative test, especially if the can be faulty. And so schools must be proactive to require the installation of filters. So think of a water fountain, but instead now it's a water fountain with a filter. So we're ensuring that kids are immediately protected from lead.
What are some of the factors that lead to Black, Brown, Indigenous, rural, and low-income communities being disproportionately affected by lead water pipes? And is there a different approach needed to address this?
Yeah, so I can say the issue is not only for lead, there's just generally unequal access to safe drinking water. And, access to safe drinking water is very strongly correlated to race. So drinking water systems, for example, that violate safe drinking water laws are 40% more likely to occur in Black and Latinx communities. So it's not just lead, but I can say in particular for lead pipes, a big issue is racial residential segregation. So the pipes have been consolidated in primarily Black, Brown, low income, Indigenous communities. And then, especially once they were installed, even if they were identified, because many of these communities are underfunded and often low income, so the residents can't pay for the very costly pipe replacement. We're seeing that there's just diminished resources and much extended timelines put into replacing lead pipes in these communities in comparison to neighboring white communities that may have been more proactive.
What
And I'll
has
just say that,
Oh,
sorry,
sorry.
I just say
Continue.
Yeah, the issue is just similar with pollution across the board and especially with plastic. So that's part of why we advocate on this issue is because plastic production and disposal are really concentrated in these communities as well. So it's compounding health impacts. And I think we need to radically rethink the way our systems work, where we aren't constantly looking to the same communities to be in a sacrifice zone where they have to give up their health, they have to be constantly put under threat so that other industry can profit. So I think it's really just prioritizing people over industry and also just continuing to focus on equity and access throughout the country.
What has been your biggest success throughout this project?
Yeah, so I touched on it a little bit. We primarily were focused on the EPA lead and copper rule over the past few years. And when we started the campaign, filters were only required after a lead pipe was replaced, which can seem a little bit counterintuitive, but actually, when lead pipes are taken out, it really disturbs the lead, and there can be a short-term increase in lead levels in the water. So it was great that they were required there, but there's also, that's just after. We need the many years before for filters to be available. So we advocated very strongly to the EPA, and we're one of the leading organizations on that. And in the new rule that came out last November, there was new requirements where all water systems, if they have continually tested over the lead action level, have to provide a filter. So that is even before the lead pipe is replaced, and that can really expand filter access to the most vulnerable communities. So it's not the end of the campaign by any means. There's a lot we still want to see, but that was a huge win for water equity and really just established that filters are the preferred method for lead abatement. And then I can also just briefly say we were really privileged to be able to launch a $100,000 sub-grant where we were diverting funds directly to leading advocacy and community groups, especially in impacted areas. They've long been leading the charge and the advocacy on this issue, so we wanted to be able to help support and uplift their really important work, and then also just expand education and awareness on filtration and the health impacts of plastic bottled water. So we're almost about halfway with the first sub-grant program, but just super excited and we'll hopefully continue it in future years.
What are some ways local communities and advocates can engage and contribute to this project?
All right, I would say go to our website, so plasticpollutioncoalition.org/projects/filtered not bottled, or if you just go to the website, you'll be able to find us easily. But we have a lot of great resources. So one, we have an advocacy focused petition on the EPA calling on them to ensure safe drinking water without plastic pollution. We highly recommend people to sign on. And if you have an organization to help co-sponsor and join the petition, we also have a really incredible advocacy packet that's pages and pages of resources on one, just learning about the issue, how to find out if you have a lead pipe, and then what to do. So there's resources on how to write a letter to your editor, how to call on your mayor, how to advocate to your community. So that's really intended for impacted communities and advocates to just help give them all the resources they need. And then we're here to really support a lot of the work at the ground level. So we're always happy to step in how we can to support those movements.
Thank you so much. That was the last question I have prepared, but are there any other concluding statements that you'd like to make?
I think just in particular to call out the new research on the health impacts of plastic. I think we really know that lead is a terrible toxic, but I think the understanding on plastics is just not as widely held. And we're finding that now that microplastic accumulation is huge. They say there could be up to a plastic spoon's worth of plastic particles in our brains. It's accumulating in our brains and a lot of our reproductive organs. And we're just seeing one, the health impacts of that, but also the many, many chemicals used in plastic. They're very chemically complex. We are getting new research almost every week of the super horrifying health impacts, but we still have no idea the full scale because there's just not a lot of data on the chemicals used on the plastics themselves. So it's just I think, a really urgent call to one, realize the health impacts of plastic, and then just also see what you can do to protect yourself. And I would say definitely looking at your food and beverage packaging is a really great place to start to mitigate your risk.
Thank you for listening to the Global View podcast. Tune in next week for another episode.